All right. Awesome. And I think that we are live on Facebook now. So hi, everybody. Welcome and thank you all for tuning in. My name is Amanda Montgomery. I'm the manager of community health education at Heartland Health Centers. And I'm so excited to be here with my colleagues, Aimee, Alana, and Josh to celebrate Medical Assistant Appreciation Week and learn so much more about what medical assistants are and why they're so important and why we need them at Heartland Health Centers. So to get started, I will let everyone introduce themselves and share a little bit about their stories and how they got here and kind of what they're doing at Heartland. But just a little bit of housekeeping too, while you're listening, if you have any questions, any comments, any thoughts, please leave them in the chat and we'll try to answer any questions that y'all have at the end of the Facebook Live. So I'll let y'all take it away. Aimee, you're first on my screen if you want to start sharing your story and a little bit about what you do now.
Awesome. So I'm Aimee Gonzalez. I'm the Director of Operations for our community and integrated sites at Heartland Health Centers. I started my career in healthcare as a medical assistant, and I was a medical assistant for 17 years before I transitioned into teaching medical assisting and medical administrative assisting at Everest College. And then from there, I came back to Heartland as a manager, and I've managed 4 of our clinics, 2 of the largest clinics, which is Wilson and Devon, and I also managed Trilogy and TUI. And then I transitioned into the role that I'm in now, which is Director of Operations. So thank you for having me.
Awesome, thank you. Alana, would you like to go next?
I'm Alana. I am the clinical health trainer here at Heartland, and that's pretty much a fancy title for MA trainer. I am also a CPR instructor and program coordinator for NEMA, which is an online school for medical assisting, and we'll get into that a little later.
Nice.
Awesome, thanks. And then Josh.
Hi, my name is Josh. I'm also a medical assistant here at Heartland. I work at 2 locations, which is Devon and Lakeview. I'm also a training specialist with NEMA as well. Overall, it's just an amazing day.
Yes, it is the MA's Day. We're so excited. So actually, Josh, I'm going to start by asking you a question first, but Aimee and Alana, feel free to chime in by just sharing, like, in general, like, what is an MA? What is a medical assistant? What do you do? What does a typical day look like for you?
So a medical assistant is typically a person that's just trained to assist a professional medical provider or practitioner. We're trained to help them in procedures as well as deal with patients and help them along their way. A regular day for me would be pretty simple. I don't really deal with too many kids, but I do deal with a lot of adults, and I help train other medical assistants that are just new into the HHC. So with that being said, most times it's pretty fast paced around here. So it's in and out. A lot of the things that we do are top thing that we do here, I want to say, is A1Cs. I never did A1Cs before at any other location that I used to work with. But here I learned how to do a lot of the things. I never did really other procedures. I've set up for PAPs before, but here you do Nexplanon, IUDs, PAPs, IUD removals, toenail removals. I'm like, whoa, but you know, like you do a lot, you learn a lot here, you know.
And I'd like to chime in because I think oftentimes we focus on the clinical skills that MAs have, but I do want to highlight the admin piece that MAs learn when they're in school. So MAs can also run the front desk. You know, they can schedule appointments, answer phones, register patients, do some billing and coding, processing those insurance bills. So MAs are trained to run an entire clinic, the front and the back. So they're very clinical oftentimes, but they also can do a lot of admin duties. And if even asking Alana, some of the things that she works on right now are policies and procedures and workflows, and that's admin. It's related to the clinical skills, but it's also very admin related. So I think that oftentimes even medical professionals don't realize how much admin MAs can do, because they tend to pull them in for the clinical piece because it's so important, but they are able to do other duties outside of that, for sure.
Mhm. Yeah, and to like merge both of those ideas, aside from blood pressures and giving injections, there's a lot at the back end that patients don't really see that MAs are involved in. And in addition to all of what they've stated, including we also do requesting records. So if a patient says, I was in the ER last night, our EMR system's probably not going to have any of those documentations. So we're also on the phone with the hospital that they were in, trying to get those documents. So yeah, there's a lot that MAs do and are capable of doing.
The other piece I want to highlight is the health education. So MAs also provide education to the patients on their medical conditions. A lot of what I learned was actually being in a classroom at the high school, teaching, reproductive health to the students. And so I would get called into the classroom and I would, do some of that. So we also tap into the health education piece.
That's awesome. It's even hearing this, I'm learning so much, and I feel like there's just a lot of versatility and a lot of skills that come with being an MA, which is really, really awesome. How do you become an MA? Like if someone was interested, what's like the process in becoming a medical assistant? And Aimee, do you want to start off with that question?
Yeah, absolutely. So, so to be an MA, you do have to be either a high school graduate or have your GED over the age of 18. And to become an MA, you can actually enroll with NEMA, and I'll let Alana explain what NEMA is. But it's an online school, and she can go into details on that. And I'll let Alana speak on NEMA, and then we can talk about how we can assist in that.
Yeah, so your traditional schools like a community college offer medical assisting programs, but this can take about 2 years, maybe a year or more. However, with NEMA, everything is online and at your pace. And the really cool thing about it is we are associated with them as an externship organization. And so when you think of externship, you're probably thinking, oh, okay, so after the program, I'll go to Heartland. Not with NEMA. Your first day of class is actually at one of our sites. So that's pretty cool. There's 12 hours of externship hours that are required. So I think that's enough hours to even maintain a part-time job and still be able to attend school and focus. But yeah, NEMA is a great opportunity, I think, especially if you're balancing multiple things. It is only 29 weeks long, if I'm not mistaken. And you get your diploma, and you can end up taking the certification, and then you'll be soon on your way to be certified and then ready to work straight after.
Yeah, the training is like 8 months in total. It's like 720 hours online and 240 hours in extern, and we're considered the externship site. And so whatever you're learning online, you actually put into practice in clinic real time. So if you're covering the cardiovascular system and you're learning about the heart online, then what you'll end up doing is practicing EKGs in the clinic. So it kind of goes hand in hand. So everything is hands-on as you go out throughout the program. You're also in our clinics learning how we do things at Heartland, but you're also learning the instruction, for the school. Alana, do you want to talk about the checkoffs and what that looks like? Because it's not just you're learning in online, you're putting it into practice in school, but then there's also a checkoff piece to make sure that you're competent in what you're doing. Do you want to talk about how we support that?
Right. So here we have 5 training specialists. So during your weeks here, you'll be assigned with one of our training specialists, Josh being one of them. And then bi-weekly, we'll be meeting with our skills coach. So she is also here as an MA, and we meet together at our Wilson location. Your instructor from NEMA will be joining virtually. So we have them there on a little tripod as if they were there physically. And with working together with the instructor and the skills coach, we're checking off your skills that you've completed during your time. So for example, the first 2 weeks may be vitaling. This is where you take the opportunity to check off your skills. If there's any corrections that need to be made, this is the perfect time that we can coach you. And yeah, we're able to assist, and you can go to different clinics as well for different specialties.
Awesome. That sounds like a great program too. And so can y'all just say what NEMA stands for?
You wanna? It's the National Institute for Medical Assistant Advancement.
Awesome. Okay. And we'll put the link to that program in the chat. But I guess just moving into that, if somebody wanted to apply to be an MA, what does that process look like? Where should they go, or how can they get more information?
Yeah, so the first thing is to apply. I mean, if you're interested in NEMA, the first thing is to apply directly to them. The process is pretty much interviews at first, and depending what externship organization you would like to go to, then they will interview you. And then after that, the process gets started. We start sending you your material, and we're always in communication, so you know what days to arrive in on site. And yeah, it happens pretty fast. Our next cohort starts in March, so there's plenty of time if you're still thinking about it to apply. But the application, there is an application deadline, and that would be November 16th, if I'm not mistaken.
Yep. But I do want to say, so you can go to NEMA, and again, there's other health centers that have the NEMA program. But why do you want to come to Heartland, right? For our NEMA program? Well, because there are options for us to assist with tuition. In addition to what we would provide for financial assistance for your tuition, we have a partnership with WIOA, which is a federal program that gives each state money for employment and training programs for vulnerable populations. And so for students that qualify, WIOA will pay for half the tuition, books, materials, supplies, transportation. And so that's a unique partnership that we have with WIOA. In addition to that, I think that, we're a great organization. Just like Josh said, he's learned things here that he hasn't learned in other places, just because we are a multi-specialty organization that offers opportunities for MAs to learn and develop into a well-rounded MA. And the other thing that I think that we do a really great job of is that we promote from within. Just like Alana, I remember hiring Alana as a medical assistant for the Wilson Clinic, and here she is, a clinical health trainer. So we are really big on promoting from within, which is what makes us amazing and a great place to work. So there's other options, but your option should always be Heartland Health Centers. I'm just putting a shameless plug out there. I'm sorry, but I think it's a great place to work, and I think most people will agree with that, right?
Yeah, actually, Alana or Josh, do y'all want to share a little bit about what your experience has been like at Heartland, and if there's things that you really enjoy about your experience here?
Sure, I'll go first. Well, when I first started Heartland, which I'm about to be a year next month.
Wow.
So I will be a year next month. And when I say that I feel like I came a long way, I feel like I came a long way. I've had everybody behind me 100% of the time. I never had any doubts from anybody. The teamwork here is just amazing. Amazing. Probably the best teamwork that I've had at any job. But the teamwork is amazing. We all work together. Everything gets done in a timely manner. I've also was promoted to the training specialist 3 months in of me working here. I felt like Heartland saw the potential that I had, and that really, that opened up my eyes so much more to Heartland, because I'm like, man, they see me, they see how I'm doing, the work is great, it's a learning process here. But honestly, if I was to ever leave, which hopefully I don't, but if I was to ever leave, I would definitely take what I've learned from here with.
Look, if Joshua leaves, it's because he's moving on to promotions and better things, right? But he's not leaving for
That is
any other
correct.
reason other than that. So we
That
always
is
encourage
correct.
growth, whether it be with us or anywhere else, for sure.
For sure.
Mhm.
Yeah, and I second the teamwork here at Heartland. Days for an MA could be overwhelming. You're running back and forth from patient to patient, setting up for procedures, getting injections ready, but you're never alone. You have a team behind you. Sure, you're assigned to a provider, but we're all looking at the schedule. We can all see if someone is drowning. We're not going to let you fall too deep. And I can say that through experience with my team at Wilson. There's days that we're a little overwhelmed. When I was an MA like a year ago, it wasn't too long ago, but the support that you have is amazing. You don't ever feel too overwhelmed because you have a strong team behind you.
That's awesome. And I know I heard you all mention care teams a couple of times, and we use care teams at Heartland. Can you all explain like what a care team is and what role the MA plays in that team?
So the care team is like a building exercise with you, your provider, and the PSSs. The MA's role is to pretty much help the providers and the PSSs from the middle, because usually if the situation starts in the front, you want to fix it before it gets to your provider. Our job is to make the provider's job easier. The provider has to see so many patients in a day. They don't have time to fix certain things, so it's our job to help them. And then it's our job to also help the PSS, like make sure, things get done right or in a timely manner, or help them learn, teach them.
And I'd also like to say that the care team is really responsible for the overall health of their patient panel. And so their role is to form relationships with the patients, because oftentimes it's always the provider that provides the care, right? And their focus is always, the relationship is usually between the provider and the patient. The thought about around care team is that patient is a responsibility of not only the provider, but the MA and the person at the front desk. You form relationships so you know what's going on with the patient. And it's just to make sure that there's better patient outcomes and that they're following through on things, and that the MA is 2 steps ahead and knows what's going on with the patient, and it's not just the provider's responsibility, but just as much their responsibility.
Yeah, so it sounds, just from everything that you've been saying, it sounds like the MA plays a really critical role, right? Like things wouldn't move the way that they're supposed to unless MAs are there, right? They have a really important place. I don't know, does anybody want to speak any more to just the importance of having an MA around? I know you all said a lot of things already.
Yeah,
I think, go ahead. I'm sorry, Alana.
I was just going to say, the MA really anticipates the needs of the patient before the patient has to request anything themselves. We do a lot of even preventative care, and that could be reminding you, hey, you're due for a flu shot. Can I just give it to you right now before you even see the doctor or nurse or provider? We are also keeping up with cancer screenings, pap smears. So it's stuff that, although you're not here specifically for, we're keeping an eye out. We're making sure that you are up to date on any preventative screenings. And again, like Aimee mentioned, we do a lot of health education too. So there's a great need for us, I think.
Absolutely. I think, and it's known, we cannot function, the health center cannot function, providers cannot see patients without a medical assistant. Medical assistants are vital to everyday care for our patients. We cannot operate without them. We just can't. And this is why we partnered with NEMA, because there's a shortage of MAs across the state of Illinois. With all of the schools closing for Everest colleges, it really put, where every healthcare organization is feeling the impact of that. And so we had to come up with a plan because we were, struggling to get people to fill these positions. And this is why we partnered with NEMA, so that we can have a direct pipeline of MAs into our health centers. Because again, we cannot function without medical assistants. They're vital. They are key players in helping our patients, through their healthcare experience at our clinics.
This is so good to hear. And I know I don't work with you all directly, but I have seen how important you all are. And it's just so wonderful that MAs are here and a part of the team. So for anybody watching, if you know an MA, please celebrate them for real this week and every single day, because they do a lot of work.
Mm-hmm.
Thank you all so much for sharing. I think there's one other question really of just like, why did you decide to become an MA? Like what kind of sparked that decision in your choosing to get certified? And anyone can start.
Go ahead.
Well, I was going to say, I think I didn't really have a good idea of what I wanted to do. I knew for sure I was interested in the medical field. I just didn't know exactly what. And the funny thing is, when I went to school, I went to Coyne College. I originally went in for medical billing and coding. I figured, okay, maybe that's a good start into the medical field. But luckily, the admissions person there told me about medical assisting. Now, I didn't know the title, but as they described the role, I was like, oh, okay, yeah, I've seen that person before in the office.
Mm-hmm.
And I figured, you know what, why not? The cool thing about MAs is if I for sure wanted to do medical billing and coding, I can put my focus there. Or if I want to do just a phlebotomy, I can put my focus there. So with just that single title, there was so many options.
Yep.
So I figured that sounds pretty good. Let me go for it.
Mm-hmm.
And yeah, it's the best decision I think I've made. I'm here now, and the sky is the limit. The thing is with MAs, you don't have to stay there. If you want to go on into being a doctor or a nurse, you have so much background knowledge already. Or if you want to go more to the administrative part, you want to become a manager of a facility, or as Aimee went on, and director, there's just so much that you can just root out from just being an MA.
Mm-hmm. Yep. And I second that, definitely. I went into medical assisting because I wanted to draw blood. I love phlebotomy, but there's so many other things that I ended up enjoying because I love to learn, right? And so I was like, oh, I like giving shots, and oh, I like the health education piece. And I was, and I think that's the part, just like Alana said, that you have other opportunities. There's other things you can do. You don't have, if let's say you just like kids, you can go into peds. If you like just working with your geriatrics, you can work with that population. Like there's options, and it makes it interesting, especially if you get bored. If you're somebody that gets bored after a while, then you have other options. Even within Heartland, like let's say you're working with a peds provider and you want to try something different, we have other specialties within the organization that you can transition to. So yeah, I think it opens up doors for sure.
Yeah, it does open doors because I came from mainly a peds clinic, and I worked one day I worked with one of the MDs here, and I have not left that MD side. I love the way she worked. But also, yeah, I was also in the same boat when it came to the medical assistant part, because right after high school, I was like, nurse. Even before high school, I was like, nurse. I did not know there was a medical assistant position. Never once blew flew past me or anything. It took my grandmother actually to tell me about it. And it's because I was always that one kid would always go to college, do the first semester, and wouldn't go the second. So she told me, she was like, why don't you just do the medical assistant? I know you want to be a nurse. I'm like, what is that? And she started explaining it to me. I looked into the programs. I wound up going to Brightwood College. And yeah, the lady explained everything to me, and it was one of the best decisions I made. I enjoy what I do. It's not a nurse, but who knows? Honestly, I feel like we do a lot more than a nurse. We're medical assistants. We help the nurses out. We help the nurses. But it was overall been a good experience.
That's so great. It's so great to hear your stories too, and just why you went into this field and what you love about it too. So thank you all for sharing so much. Before we close out, is there anything else that you all want to share that maybe we didn't capture in this live so far?
Go to NEMA and apply. Select Heartland Health Centers.
Yes, and just to recap, so people can go to NEMA's website and apply, and the deadline is November 16th?
Yes.
Okay, awesome. Anything else to recap about where people can go or the application process?
They just got to go on the website and just start filling out the paperwork. And then from there, they'll contact us. We'll set up interviews, because we do interview anyone that does apply, because we want to make sure that whoever applies is a good fit for the organization. We'll set up, interviews. Alana will set up interviews. And then, and that's essentially, where you start. Just go on their website.
Awesome. Okay, and we'll put all that information in the chat. So if anybody wants to know how to find that, we will share that with you all. And feel free, for anybody watching, I think we got some shout outs for you all, so that's exciting. But if anybody has questions that come up later, feel free to put them in the chat and we'll try to get them answered later on. But thank you all for watching. Thank you, Aimee, Alana, and Josh, for being here. This was so informative, and it's just so nice to spend 30 minutes with you all. So thank you all again.
Thank you. Bye.
Thank you.
Bye, everybody.